guys, good evening. This is Dr. Jenny Yusuf, physical therapist and doctor of physical therapy. I'm the creator and founder of Balance and Pulse Support Group in Aging Adults and the current vice chair of the Global Health in Aging Adults in the Academy of Physical Therapy Association Special Interest Group. And if you have any questions, we always going to do a highlights in the Balance and Pulse Support Group. And also, we are so fortunate for tonight to do the Thanks God It's Thursday. So before anything else, if you are in Philippines, magandang umaga, guys. And if you are in Saudi Arabia, salam alaikum, Abu Dhabi, Qatar, to all my colleagues there, salam alaikum, marhaba. And to Canada, hello. So we are all over. We are global therapists, and we have another innovator, academician, and entrepreneur. And we have Dr. Lily Bautista. Dr. Lily Bautista, thank you so much. She is a doctor of physical therapy, and she is the current president of the PAOMPT. PAOMPT is the Philippine Association of Orthopedic in Manual Physical Therapy. If you remember Dr. Yul Hontilia, he's the past president. He's one of our speaker in the Geriatric Rehab Summit. And now we have Dr. and founding officers and president also of the PAOMPT. And Dr. Lily Bautista is also the current director of the Institute of Rehabilitative Sciences, all right, and also in the Silliman University. And she also initiated and the director of the Free PT Clinic. In the Free PT Clinic, she will explain more on all of this. That's why she were here. So thank you so much, Dr. Lily Bautista, for all the things that you're doing. That's amazing. Welcome.
Thank you so much for the invitation, Dr. Ann. So it's really like an honor to be here today with you.
You are welcome. You are welcome. So thank you so much for this time with you. I know it's a really having a difficult time in Philippines right now, and we're sorry to hear what's happening in some of your constituent in your town and also the neighboring places. That's why I believe that we're having difficulty in even the signal at one time, right? So luckily that we're able to catch up. So how are you? How's your place and your loved ones in the Philippines from the recent typhoon Odette?
Okay. Well, we are fine. So again, I cannot complain much with, we had loss of power, telecom, water, but that's really very small if we look at the devastation that hit other people. So that is the main focus that we have right now. So there's a lot of places that still do not have actually drinkable water. So that's the problem. And some we still are not able to reach. Some people are still looking for their family members. So we have been fortunate enough. We're in Dumaguete City, so we're a little bit on the southern part of Region 7. So our power, actually Dumaguete's power came back like within a couple of days, so it wasn't as bad. But that the northern part are the ones that are really, really affected. And that's really only in Negros Oriental. We're already like the fourth or the fifth island, I'm not sure, coming from the east. So medyo lesser na actually supposedly the force of Odette when it reached us, but it was still very, very bad. So I can only imagine the areas like Leyte, like Cebu is like really bad right now. So we're kind of praying that hopefully that we
Yes.
can overcome this. But this is where you see all the bayanihan though. Like you see everyone just like very busy trying to help out in any way they can. So and that's really, really wonderful. So that's one thing about the Filipinos, no? So I
Yeah.
mean, even even with like limited income, they will do whatever they can to help out their kababayan. So
That's true. That's true. Even we have all these challenges, they keep smiling. They keep lots of kindness in their heart, in each other's heart, and they're able to help. Even they even have their own challenges in their own family or own home, things like that. We will be including you in our prayers. So to to continue our interview, we are so honored for you to be here. And we would like to get some of your experience and also share your knowledge to us. You're amazing knowing that you're a doctor of physical therapy, you're finishing your PhD, you're the current president, and also the dean. So, how do you handle all of those things? And at the same time, you are doing those amazing webinars, so you're able to do those membership for the PAOM. So let's explain first, how do you transition from a clinician and then now to become academician and to your leadership?
Okay. So from let me start with the leadership, I guess, question. There is not much transition. So just a kind of a brief history. Like way back when I was an intern, I was already recruited by one of the doctor here. One of our affiliation center when I was an intern, and he wanted me to work for the center. And so right after graduation, back then you didn't need a license. You can actually practice right away while you're waiting for your licensure. So I wouldn't tell you the year, but during my time. And so I actually started with a leadership role right away, and I was shocked. I was actually surprised. I thought I was just gonna be like a staff PT, but when I got hired on, I was placed as a clinical supervisor, and then within, I think, a matter of, I don't know, like 2 weeks or 3 weeks, I became the chief PT. So I have always been actually on the leadership role, and then moved to the US and still, kind of manage like, various centers, more a clinical role. So now transitioning from clinical to academician, I always loved teaching. So even when I was in the US, I actually considered like becoming an instructor of one of like the universities in the US. But financially though, it was so far out in pay, and at that time, of course, we were not very stable yet. And so what I did is I did like some uh, speakership, like by invitation, like special courses. My specialization at that time in the US was industrial rehabilitation. So I was in FCEs, work hardening, work conditioning, and then vestibular, and then manual therapy. So I would get like a yearly invitation from several schools in Houston. And that's what I kind of like, did, because I really, like to teach. And so when we moved here in the Philippines, then that was my goal. My goal was like, okay, I think I can teach, and I think I can help the Filipino people, because I was already going to retire at that time. So I'm like, that would be a kind of a good part-time job, like with retirement. But um, just like wherever life always takes me, I always take that opportunity. So now I'm actually full-time instead of, I was only part-time for a few months, and then like full-time load like right away. So that's where I'm at now. I started at Silliman University in 2016, I believe. And then that was part-time, and then 2017 full-time.
That's a lot, yes. So you talk about vestibular and manual therapy. Of all those courses that you remember, what do you recommend for our other colleagues and therapists that who would like to certify or specialize in that kind of field? Vestibular and
Okay,
manual
and
therapy is great.
okay. Now, vestibular rehabilitation, I would suggest that people attend like there's many small courses out there. That's what I started doing, because during my time it was not really included in the curriculum. So I did not know about like the inner ear, like nothing like that. So never even covered in anatomy. So, but I found it kind of interesting and amazing. And then at that time we were also looking at special programs, like at our where I worked for Select Medical Corporation. So, and we wanted like some specialization that's still kind of untapped. And I started finding interest in like a vestibular rehab. So I attended like several courses. Um, and then after that, what really helped me, but I really would suggest you take small courses first before you do. I did the vestibular certification through the Herd. Well, at that time it was through Herdman Institute. And so I'm not sure what it's called now. So that was like in 2012. So I'm not sure anymore. But it was like through Susan Herdman,
Yes,
and that was
Susan.
like in. Is that still ongoing? So I'm not
Yes,
sure if they're
yes,
still doing that. Okay, so that was
yes. It's unheard of. Mhm.
very, very helpful. But I think though, again, I suggest taking smaller courses first and treat patients, because the unfortunately, like when you go through the certification, like for us with our group of Filipino PTs that I met during that certification, only two of us actually passed the certification, because some people, they think that it's an entry level thing. It's not. So I would suggest that people do, again, smaller courses, and then treat patients in vestibular, and then go through the certification process. And then with the manual therapy, same thing. Like Select Medical is actually very big on manual therapy, so that wasn't very hard for me to transition into that role. Also, we have like the big names, no, like we've had like, Mulligan, we've got many different kind of schools of thought that they were invited at Select. And then to move forward with that, we went through certification through the Ola Grimsby Institute. So that's what we kind of did. And again, that was like after already treating. So I really would recommend that. Like before people start kind of going into like the major certification, to really practice it first. It makes it easier to pass the exams.
That's nice. Yes, I always inform them and I always share that invest in yourself, right? So that's really really good. That we have now also the American Institute of Balance. We have Dr. Gans.
I
Yes. So
attended that. Yeah,
yes,
I attended a course from them. They were very good. So that one I would
yes,
suggest. Yes, I would suggest that. I attended, uh, I think like maybe a couple of courses from them.
yes. They have a
So
lot. Yeah, they have the they specialize. They are certification. Now they're offering hybrid because of the pandemic. Before they are only online. So they're all over
ah,
different states and they're based in Florida. So if
ah,
ever we have any colleagues that wanted to do more on in a group, so I can connect you with Dr. Gans. So they
mhm.
are one of our speakers also from the recent summit. So they're good, very accommodating. And
Yeah, very good program. I would
yes,
suggest, because
um,
now that you mentioned them, I remember taking a couple of courses like from them
uh-huh.
also.
And then I think manual therapy, you have we have because I did mine in not in Saudi Arabia, in Abu Dhabi. So we have Mulligan, as you've said, Mackenzie, and the kinesio taping. So those taping, so we have that too. So that's really good. So you really have the passion. What motivates you, Dr. Lin? What motivates you to do that now that you just informed me that you worked before in Select Hospital or in America and now you're in Philippines, wanted to retire and then ending up to continue helping and educating our colleagues, your students.
I I think, to be honest, I really think that you must find your own intrinsic motivators. Like, what is it within you? Why is it that you want to do something? Um, of course, the extrinsic are good, right? Like the financial, the social, kind of interaction with people, like all of that are really good. But I think intrinsic is very important. What is it that it's coming from inside of you? So for me, it's like, first it's, I was always, as a clinician, I was always driven by the question of like, what can I do more? What can I do for this patient? Why can I not understand her diagnosis? What am I missing here? So I always have that question in my head. I always have, I don't know. Thankfully, I think thankfully I took a course and graduated from a course that I felt passionate about. Because I know, we cannot say that everyone, like, right? Some people really end up in the wrong course, in the wrong field, but I ended up, I think, in the right field. And so I always first have that question, like, what can I do for this patient? Why is it that I cannot understand? Why is it that like I cannot like figure this person out? And usually that one drives me. So I attend so many courses. I don't just do in Texas it's 30 hours. It's like almost every 2 years I probably have over 100. Like, so I do a lot of courses. So that's why my husband calls me like the professional student. I'm always like attending courses. Um, and then also like you have to kind of find out who are you doing it for. So for me, I'm doing it first, like for my patients, now for my students, and then for myself. Because whenever I do something for my student and then my patients, and I feel really really satisfied, and then that motivates me more to kind of like better myself. So then it kind of goes around in a cycle, I think. So I think different
Nice.
yan. So there we cannot like really identify what can we do to motivate a certain individual. I think that individual has to find it within themselves on what will motivate them intrinsically and extrinsically.
Nice. That's really good. Like, it's my first time to itemize and also signifies intrinsic and then extrinsic factors of your why. So that's new. That's really good. Yeah. We always need to know first our why, and then later on the passion is there. And also we need to know how can we help. Now there's another outlet for you by serving
Yeah.
the KM. So tell us more about, and thank you for serving as the current president of that. And I always see some of the courses, the webinars that you wanted to educate our Filipino therapists, but it's still global as well. So tell us more how it comes up, what's your mission and vision, and if there's a membership that you want to offer for the other therapists.
Okay. So the mission vision of PAM is very, very simple. We just want to unite like the various OMPT practice in the Philippines. When we started this, like Andre and Yul, I was like back in 2014. There's many courses offered in the Philippines. But there's the way we see it is like there's a little bit of lack of cohesion. So like even Filipinos, if you ask them like what's the difference between this OMPT versus this OMPT, like let's say one from Africa, one from Canada, physical therapists here could not even explain really like what's the difference in the schools of thought. So we are not PAYOM is not going to say that one is superior over the other. So we really would like to unite because anything that in any kind of treatment is always that eclectic approach, right? So one school of thought might have something that might affect your patient in a positive manner, and then the second school of thought another one. So there's no one technique that is all inclusive. No, so we really would like that. We really would like to see all of the manual therapists to just kind of have that sort of approach. And then not only clinically, we would like to focus. The main mission at this time is like education, and then hopefully research. Education because we think that it needs to start at the school level, because if it's not being taught in school, this people who will graduate, they will become the clinical instructors. So how can we now instruct as a clinical instructor if we did not learn it in school? No, so right now there's a main initiative of PAYOM wherein we're creating a journal of for educators. So it's a manual for educators that will disseminate hopefully later on to the faculty members, so that way they can disseminate that to the students. Like because up to now, Doctor, it's still limited. Like most schools still are very big with like peripheral joints, but they still don't touch much of the spinal joints. So that's we would like to kind of like focus on that, and then hopefully that will carry on later on through graduation, and then when they become like clinicians, then they would be able to disseminate to their own students. Because like for example at Siliman we have uh, a very good program in manual therapy, so spine, peripheral joints. But the problem is like when they become interns, they don't get to practice it because, as more often than not, there's some CI. Don't get me wrong, some CI would allow them to practice, but in the Philippines, it's still very new, I think, which is So again, we're behind on that. So they don't allow a lot of our students to do manual therapy yet on their patients. So the students are basically acting as technicians doing the modalities and exercise. And so we would like to educate the clinical instructor that, hey, these are being taught in schools. So like the interns, just like in the US, right? Like we allow our interns to practice and then do their manual therapy skills. How can you graduate with your skills if you never really did the skill set during internship? So that's kind of like, one major thing. So education, and then research. So that would be another main focus of PAYOMP as we start getting a lot of people graduating from our OMPT courses. And so then hopefully like these people will start disseminating new information that would validate and then also maybe try to answer some of the questions that some of these clinicians have regarding manual therapy practice.
Wow, that's really good and very, very all you already explained the vision and the mission. And that's really amazing knowing that we want to educate and we want to improve the research, especially as a clinician and also thinking as a head or a hat as a student. When we heard about research, it's always so difficult and it sounds so complex. And now that they will be more aware what and how, and it is really important that it should be from the in-house, begin from the school and then later on. And I like the hands-on. I believe that experience is really a good teacher. You really need to be there. That way you will not be overwhelmed when you are out in the field, right? So that's really important
Yes.
to do that. That's
Because
great.
after they graduate,
Mhm.
yeah, because after they graduate, you're supposed to be independent. So then who would be watching after you, right? So the best time to really practice is when you have your clinical instructor with you to kind of guide you, especially with these advanced skills that we're talking about. And I forgot, I think your question also is membership. Our membership is very cheap. It's only 600 pesos for 3 years. It's renewable. Now, why do we charge 300 pesos? Because PAYOMP is a member of, is a registered interest group for now, registered interest group of the International Federation of Orthopedic Manual Physical Therapy. And that comes with yearly subscription that we have to pay. And PAYOMP is also in application right now to be a member organization. So member organization would mean that all of the graduates like here for let's say OMPT practice would be recognized internationally. So meaning if they go to the United States, like in Canada, they have the FCAM, right? So they go to the US, it's accredited, it's recognized. So if we become a member organization and they do their certification here in the Philippines, then if they become a fellow in like PAYOM, FPAYOM, then when they go to the US, they would be also recognized. So,
That's
and
nice.
that
Yeah.
also comes with cost. Okay, so and the 600 pesos usually goes to that. Plus, we also have other benefits like we have free life insurance and accidental death and dismemberment. So, and then we have sharing of articles, researches, and then we give them the free webinars or significantly discounted rate on the webinars with CPD units. So there's a lot of like benefits to get out of the 600 pesos.
Wow, that's really affordable, knowing that it's for 3 years, right? And then with
Yes,
all those
yes.
benefits. Yeah, so I saw some of your webinars and really nice, great speakers. And now I want to know if what are the benefits. That way we can share your I have small platforms and I have majority of clinicians and focusing on balance and pulse and more neurology. But right now we're also dealing with many orthopedic cases. And then I remember we have a one wonderful manual therapist here, Dr. I forgot his name. He always explained that there's no like specific geriatric Jenny is always everything. You are always an ortho in everything because you don't specify geriatric, only geriatric. And then only neuro, only neuro. The cases touch always with orthopedic. Even it speeds, there will be orthopedic cases too, right? So I agree with you. So thank you so much for sharing all these skills and knowledge. And if you have any advices for our Balance and Pulse member who are clinicians and also caregivers, what are those things?
Um, I guess that my main advice, I'm not really sure if I can enumerate, but um, my main guiding point with what I do is you kind of have to like, even love, if you can love what you're doing, because you cannot go wrong. Okay, so um like an example, like when I almost all of us, I have never encountered anyone who has not encountered like a plateau. They feel that they're lost. They feel that they don't really know if what they're doing is still what they want to do. No, like for me, I went through that, and what I did is like I didn't want to stay in an environment that would make me so unhappy and so depressed and all that. So I actually left. Like that was in with Select Medical at that time. So I left and then I tried other things. So I, dipped into home health, dipped into like uh skilled nursing facility, acute care. But then at the end of it, then it makes you realize, you know what? I really love outpatient orthopedic. I really want to go back to my patient, my outpatient, my chit chat with like, I want to like, do a lot of like gossiping with my patients while I'm like, treating them. So I really miss that. So then it makes you realize that, okay, this is really where I belong. And so actually after that time, it's like that's where I would always go back to. And stayed happy, like so I went back at my previous job, and thankfully they valued me more, so they actually accepted me without any problem, and I got to keep my tenure, by the way. So that's Select Medical Corporation, guys. So I really had a good experience with them. If you want to work for them, so at least on my side of the country. And so again, like find something that would make you happy and something that you would love. If you don't think you are happy, then you have to find something else, and that will kind of guide you, that will like help you out with your career, and it will prevent you from going through like some of these like negative experiences that people kind of go through. So
That's really nice. That's really a great advice. You need to know and you need to be happy on what you're doing, right? Because everything will be easy when you're enjoying what you do. And especially when you love what you do, right? And bonus because you love what you're doing and you're able to help other people. So that's always bottom line. Thank you so much. And if
and
ever,
and
go ahead.
and you know what also, I think one last thing, when you make a decision, even if might not be the best decision, no, like sometimes you regret the decision, but if you really make it, you stand by it and you make the most out of it. So I kind of truly believe in that. You try to give it a chance. So maybe in the end, like after a few months, maybe it's the right decision after all. So don't give up on the decision right away just because it did not end up the way you wanted it to look like the very first 2 months of you, making the decision. So
Ah, that's also a good point. So you just want to just be like it's a gamble, you know. What I can say is that change. If you are not outside of your bubble and you're always on your comfort zone, there's no growth, you know. So we really need be to be challenged always. Don't be comfortable on your comfort zone if you want to have a growth in everything. You need to be challenged if you feel that there's some problems and you're having difficulty in things that you're doing, it means you're making some progress, so that's really good advice as well, so they don't feel bad if they did they decided something and they think they had a mistake, so that's a good advice to Dr. Lily. Thank you so much. So if ever they
yes.
want to connect with you, how they can connect and call, message you, ask something, knowing that you are more specialized in vestibular and orthopedic, who are listeners in Philippines that wanted to be a member of the PAYOM. So how can we connect with you?
Okay. I would also like to mention, I think I forgot to mention our free PT clinics. I would just like to plug that. Uh, for this is really open to all indigent population and low income population. We have been focusing more so on the Negros Oriental, but even if you're not from Negros Oriental, we really will help out. All we need is a barangay certification of low income. And in the Philippines, usually that's defined as under 20,000 peso income per month. Um, or if you have an indigency card, then that's even easier and better. Or a senior citizen card. Okay, because senior citizen, that's automatic that you will be accepted for free services. And this is truly free. We've been asked by many people, is it really free or will you be asking for donation? No, we don't even ask for donation. We don't even talk about money. So it's really free. It's really a service to the community. And so I hope like, people who are in need would avail of that. We are on Facebook. So you just search for IRS free PT clinic and that should pop out because we also have interns who are very, very active with like promoting videos and such like that with social media exposure. So you can find them in Facebook anywhere. As far as contacting me, I'm very also active in Facebook. So you can just try to message me. I have two accounts. One is the Lily Bautista and the other one is Libout. Li space capital Baut. So Libout. That's kind of my professional thing. I try to put everything in there because otherwise, like it gets so mixed up with my Lily Bautista personal account. Or email lilydbautista@su.edu.ph.
All right. Thank you so much. I will going to put all those emails, guys, once we posted our interview with Dr. Lily Bautista. Thank you very much, Dr. Lily. I know it's really hard in your area right now, but you're able to give us your time and share your knowledge and expertise to our listeners, to our clinicians, and also to our different mentors and coach like you. So we appreciate all of what you're doing, especially to our indigent and constituents in Philippines, sharing your knowledge and your motivation to your students. And congratulations to our all Siliman new physical therapists in Philippines. So that's amazing, guys. So any last message, Dr. Lily?
I think I've said a lot already. So again, thank you so much for inviting me and allowing me to share some of the things that we're doing here. We really, really also appreciate. I would like to special mention our people from the United States, like Doc Jen here, Future Foundation, like Yul, Andre, all of them, they are all full-time workers in the United States, but so very, very active with like, the promotion of physical therapy practice in the Philippines. So we really appreciate you guys. We get a lot of support from the US. It really comes a long way. A lot of our speakers are from the US. And actually now we're expanding. So we've got UK, we have people now from Korea, from Japan. We've met a lot of people along the way. So all of these things that we do, it might be a little bit of work, but it opens like thousands of opportunities. And so, and you meet wonderful people along the way. So I think those are already like the bonuses. So we thank every single person who again supports the Filipino physical therapist.
You are
Thank
very
you.
welcome. You are very welcome. And also regarding the support and everything we talk about Typhoon Odette, I just want to continue. We posted it recently, Dr. Lily Bautista and also the group in Siliman University and the student organization of the Siliman University made an account for a fundraiser for the Typhoon Odette, for their place, for their town, for their school, and also for their members. And I think some students or teachers or who are affected really. So if you're able to donate, so connect with them. We already posted those accounts where you can connect, and also we have some people here in United States donated in Zelle of Dr. Lily Bautista. So check out those, connect with her on how you can help. If ever you're able to donate more than 25 plus dollars, I will be able to give you the access of the recent geriatric rehab summit. It's 49.99, but you will have those things and you can share it to your others if you attended it before. So as a way of thank you for supporting them. So God bless you all, guys. Thank you so much, Dr. Lily, and we appreciate you. More power and be strong, Philippines. And we will be continuing supporting, as you've said, the Future Foundation and also Fissiogen PT and Wellness and Balance and Pulse Support Group. All right. So, guys, thank you for listening. If you have any questions and you want to connect with us, connect with Balance and Pulse Support Group. It's once again Dr. Jenny Yusuf, physical therapist and Doctor of Physical Therapy and clinical geriatric specialist and certified exercise expert in aging adults. Bye for now, guys, and God bless. Thank you so much, Dr. Lily. God bless.
Bye. Thank you so much. Thank you.
Welcome.